Okay, hi everyone. Can you hear me now?
We can hear you if you can just click present on your presentation.
Yes.
Perfect. So the floor is yours, Eva.
Thank you very much. I'm very happy to be here. Thanks to Jakob and Outriders for the invitation. And I'm also looking forward to meet you later because it's very strange to give a presentation without seeing the people listening. As Jakob said, my name is Eva. I work for Deutsche Welle, DW. Deutsche Welle is the German international public broadcaster. Public broadcaster means that we do TV, radio, social media, and online news. And our target group is basically the whole world except Germany and Central Europe, so everything else, with focus on some Asian countries and African countries. I would like to start the presentation with give you some snapshots about how Deutsche Welle is covering the corona virus situation and how they work at the moment. And so the first observation is that we all need to improvise at the moment. That applies to all of us, I guess, and it also applies to Deutsche Welle. So if you look around at the Deutsche Welle premises, you see barely people there. Most of our people are working from home office, also the journalists. And what you see here is a newsroom in Berlin. And usually that's a very, very busy place. But at the moment, there are only two people sitting and they're working with masks. And also it has been reported to me that most of the journalists in-house, that they're wearing gloves. So this is the situation at the moment. Then we have still TV running, and this man, he's one of our presenters, and as you can see, he is in home office and tries to set up his video studio in his garage or cellar, and it looks very chaotic, but kind of he managed to look serious while presenting the news, and he's not being distracted by the letter on the right corner behind him. And as you see, it looks fine on the camera, and on TV it also looks like nothing happened. That's the current situation. And then we also have radio. For radio, we mostly, our journalists mostly need to still go to our studios, but you can see that there's also special protection. Okay, but the main question now is what impact has Corona on our coverage, our news coverage? First of all, our program has been shortened and cutted. It already was introduced in mid-end of March, where Deutsche Welle said, okay, we will lack on resources in the upcoming weeks, so we can't do the same program as before. So we need to cut some programs, but this is okay. And we're going to focus on youth, science, and health instead. And what is very interesting, I find, is that they, especially on TV, they promoted it very transparently. So they said, okay, we have a crisis going on now here, so this is one of the consequences, and we want our audience to know about it. I guess it's not a surprise that now the focus lies on news and science and health, and we talk about news. We also talk about Corona non-related news, but being realistic, most of the news that we're covering at the moment is related to the crisis. What I also find very interesting, I said that we are a public broadcaster, and usually public broadcasters are not moving very quickly, but somehow they surprised me as well by developing a new format during this crisis. And there's a new format, it's called In This Together, which has a very human touch. And what is interesting, that it was developed, like the concept was developed and was produced by people who are all working from home, and from people that don't know each other. So someone managed to build a team and successfully introduce a new format without having like this usual physical meetings and interactions, what I find very fantastic. So the second observation, or the second thing I would like to talk about, is traffic. That's a very short one, because traffic is booming. It's incredible. To give you some insights, on the months of March, we had over 1.1 billion visitors on our digital platforms, TV or radio, and this is a very, very high number for us. And we had that goal to reach more people in the next 2 years, but this is much more than we ever expected for. So this is fantastic. What I find a little bit critical here is that usually Deutsche Welle stands for very diverse coverage. At the moment, it's the opposite of being diverse, but it's very corona driven, and it is this topic that brings us all the people. The next observation, something that I call the Merkel effect. I shouldn't probably call it like this. This is probably not the most accurate term, but there are two reasons why I call it like this. The first reason, what we observe is that since Germany has a very high number of positively tested COVID patients, but the number of the mortality COVID-19 rate number is very low. And that makes it an exception. And this is why many countries are interested now in our numbers. And they want to know, of course, how did we manage to do that? I'm not diving into this topic, but this is one of the reasons why many countries outside of Europe look at Deutsche Welle at the moment. Another reason seems to be Merkel, because it's very often it's noted that she is a scientist herself, and this is why she is doing maybe a good job in governing and guiding us through this crisis, because she knows how science works, and it's something that is helping now. And as I was preparing this presentation, on my news stream, this article by The Atlantic popped up. It's called "The Secret to Germany's COVID-19 Success. Angela Merkel is a Scientist." So this is just proving my hypothesis here. And the numbers demonstrated as well. So far, having those, we really notice that many, especially in Africa and Iran and other parts of Asia, much more people than before used to go to DW websites and other program to see what's going on, because it seems like they feel well informed by us. Okay, now we talk about the corona coverage in Germany, and I just want to highlight this is a very subjective observation here. I guess there are different journalists and people in Germany who probably highlight other points than I will do. But the first one, and I find this the most important one, is that that I observe a rise in science journalism, and it's huge. My feeling is that there is a real hunger of detail and depth at the moment, probably not from all people, but from many people. And people really want to know what is going on, what does this crisis and this sickness mean to us and to our bodies. And this is really huge. To give you an example, there's one podcast that's called the Coronavirus Update that started beginning of March. It lasts about 30 to 40 minutes, a daily podcast, or used to be a daily podcast till 2 weeks ago. Now they publish 3 episodes every week. And it's a very, very pure and basic program. So basically you have one science journalist, and you have one virologist, which is Professor Dr. Christian Drosten, who's one of the faces of the corona crisis, and they talk for roughly 30, 40 minutes about science behind the coronavirus. So it's very, it's like a lecture, and it's very, very detailed. So if you are interested in what exactly this virus is doing to your body, and how you can treat it, and so on, I recommend you, if you speak German, to listen to it, because it gives you a lot of information, more information than any Wikipedia page would give you. So this is very, very nerdy, and you would assume that only a couple of people would be interested in that or take the time to listen to it. But the numbers show that that millions of people listen actually to this podcast. So this podcast is distributed through different platforms, such as YouTube. When you see one of the most popular episodes here that has roughly 930,000 views, then you also have it on Spotify. On Spotify, it is for weeks now on the top 10 list of most heard podcasts, and it's really famous. Also, news is picking up this podcast to report about it, or to report about topics that's being discussed in this podcast. As an effect, so I mentioned at the very beginning that there's this Angela Merkel phenomenon, But I think that in Germany, the actual face of the crisis are those virologists. So the one that I just introduced is one of them, but there are two more, and you see them everywhere. So there's also a satire already going on, covering or making them as a subject to their coverage. And as the European Football Championship can take place this year, they suggested as a joke that instead we can have a sticker album not covering Ronaldo, Lewandowski, and co., but virologists. There's also a lot of criticism going on, or maybe not a lot, but there's criticism saying that virologists and scientists are governing country at the moment. Is this really like how we want to be governed? But in general, I would say that those people and the role of science is being quite respected. Okay, let's move forward to another observation, like a geographical focus. That's something that I noticed yesterday in the evening while listening to the news, and I thought that it's nice to bring it to your attention as well. So when we look at what is covered in the crisis and which countries are being a subject of this coverage, it is probably obvious that China plays a big role, but also South Korea right from the beginning, because of their good management, was part of the coverage very early on. But later on it moved, the focus really shifted on Europe, especially on Italy and the UK, especially when Boris Johnson went to the hospital. Also Spain, even though it's almost as affected as Italy. I wouldn't say it's that much a topic, but of course it's been also covered in the news. And Europe as a whole, so talking about the European Union. But then the US is a huge topic, and I would say in the last week to 10 days also Latin America, mostly Brazil, and Africa. I put it in brackets because Africa as a country is referred to as a continent. Africa as a continent is referred to as a place where people are very concerned how the coronavirus will go on. I still find that it's a very, very narrow perspective, because we talk about a pandemic, we talk about a global health crisis, and I find that our media is mostly really looking in some certain directions. So that could be broadened up. Then the last observation covers data-driven journalism and them being cautioned. Since I'm a data journalist, I wanted to also give you some insights about my observations there. So what is happening in Germany, I find that there are very, very, very fantastic pieces out there that do based on data-driven analysis. Like this one, it was published yesterday about intensive care beds and units in Germany, and this is an up-to-date map, so you can really check on a daily basis how your region is doing. You can even zoom in and look at the specific hospitals to see whether there are still intensive care units available or not. And this is something that I find really good and very well done. And we have many of those very good pieces at the moment. But there's something else that I observe. So usually you would say that now, as maybe for science journalists, this is the time for data journalists to rise and to shine. But when we look at the data, we see that we have lots of data, but it's very, very difficult data. So the data we have, like the numbers that we're looking at, we compare many numbers that are not that comparable usually. We also have many undetected cases. So it's really hard to really know what is the situation in a country. And when we compare countries, we usually only look at the number of positively tested patients and the death rate, but there's so much more. So we are very, very, very careful when taking these numbers. Because, and that's another reason, very often numbers at the moment, they seem to demonstrate or to show that there are certain correlations where we don't know if these are actual correlations. And so our feeling is that it's very easy at the moment to jump to conclusions, especially when we talk about which restrictions are helpful or which actions, governmental actions, are helpful to fight this crisis. Then it's way too early to say it now. But of course, our journalistic enthusiasm is not easily stopped, and that's something that that we are observing. So instead of having data journalists now producing many stories all over Germany, my feeling is that they only do stories. Most of them only do stories where they're really sure about. So it's not that much. But what I find interesting is that that it happens at Deutsche Welle, but also to other media outlets, that the data journalists are now considered more as experts for data. So there are many pieces like on a meta level pieces where we talk about numbers and what they show and what they don't show. So it's also a way of explaining the current situation. Okay, this is all about the coverage now in Germany that is actually happening. And now the big question is, what is missing? So I did, when I read the question, I did not really think about what is missing in the general coverage, but what is missing in the Corona coverage. And there are two things that that I missed. The first one is humans. As you can see, I'm very number-driven person, probably because of my job as well. So there are many human stories out there, but I think that there could be many more. At the moment in Germany, I find it's very numbers-driven, the whole coverage, and also when it comes to economy and financial situation. And we talk about humans, but humans in lockdown, and for instance, families, how they deal with their children being at home, and so on. But we don't talk that much, I find, about the situation in hospitals, about patients, about recovered patients, about death in families, and there could be much more. So my wish would be that this whole blank white slide is filled with many human faces. Then the next thing, and this is the fight of disinformation against disinformation. That's something that is already currently happening, and I think it's also many institutions realize that disinformation is going on and we need to do something against it. But I think we could do much more, and it's something I really hope will stay on the top of priority list for the next not only weeks but months, because there's so much nonsense out there, and there's so much really bad and killing wrong information out there that needs to be and we need to talk about that, and we need to also take our audience with us and explain them what they need to look out for if they encounter information that seems to be tweaked. Okay, this is it for my observations. Many thanks for your attention, and I hope to see you later.
Thank you very much, Eva. Normally here we have claps and so on. So I really agree with you that on one hand, it's super nice and easy actually to organize those events and bring people in. But I also miss this connection with people and, and so on and so on. But thank you very much. It was really interesting. Couple questions. Did you say you have over 1 billion visits?
Yes, 1.1 billion. But it sounds a lot and is a lot, but it's, as I said, so we are covering actually, Deutsche Welle is present everywhere in the world except in Germany and Central Europe, and we have TV, radio, and social media and so on. So it's not like we are a small news media outlet.
I know.
Yeah.
Outriders is, so when you say billion, it's like a financial minister saying that they're dropping a couple millions. Normal people just simply cannot visualize this amount of money, so that's how I feel. I also wanted to ask you, because you've shown a couple of examples of those data visualizations, if you can drop them either to chat or to Google Doc, because we have this playlist and we would just update it with, more data stories, which you have. Or because I guess some were produced by you or some by other outlets in Germany, so we could just do it. And there was a question from, and I hope I will spell it correctly, from Auburn, a little bit on the side, but she's asking, if you felt any financial impact for now from coronavirus on on journalism in general.
Yeah, in general, yes. There's it's not that easy. I guess it applies to all media outlets in Europe or the world. But since it's a public broadcaster, we are quite financially stable, and this is that works for us pretty well at the moment. So we are very lucky, but of course there are less people working and we have many freelancers, so they notice that. But at the very beginning in March, it has been said that all freelancers they were supposed to work in March and April and whose shifts would have been are cancelled now, that they will still get paid for at least their shifts till the end of April. And now from May on, we need to see how the situation is going. But luckily, this time I can really say that they're doing a good job to support us. But I don't know how it will look like from May on. And I know that we are very privileged here.